Hello, everyone, and welcome to the DPC Education Center's webinar on a post-election recap. Today, we will learn about recently passed policies regarding kidney disease, an overview of the 2022 midterm elections, and predictions for the 118th Congress. Before we begin, we have just a few reminders for today. All of your lines are muted. If you have any questions, please feel free to type them into the chat box. The icon for that can be found at the top of your screen. Written questions will usually be answered, it says at the end of the program, but if you have a question, please feel free to drop it in the chat box and our presenters will address it accordingly. You will receive the link to the recording and slides from today within a week, and please complete the feedback form at the end of the program. At this time, I'd like to turn it over to our speakers, Mitch Vakerics and Erin Graefe Dorton.
Great. Thank you so much, Hannah. This is Mitch Vakerics with the Prime Policy Group, and I'm joined by my colleague, Erin Dorton.
Hello.
And there she is. Hello. Erin is here, and we have been and continue to be honored to represent you guys up here in Washington, D.C. You are a great client with great issues, so we're thankful for that. And we have been asked to talk about the most recent elections, the midterm elections, how those went, and what that means going into the next Congress, which is the 118th Congress. So I'm a Republican, Erin's a Democrat, so you're going to get both perspectives on this call. And as we discussed with Hannah, if you have questions, please just put them in the chat. We'd love to have this be interactive and more conversation than not if we can. So with that, let's go ahead and get into it. I'll start things off, and then we'll let Erin add her input as well from a Democratic perspective. So go ahead, Hannah, if we can go to the next slide. Now, so the big talk of the town is the red wave that wasn't. So it was pretty remarkable. We had all the pundits, all the analysts predicting a massive Republican wave in the midterms, and that did not happen. Historically speaking, the president's party always suffers losses in the first midterm, as voters are typically unhappy and want to vent against the party in power. And we were facing a historically unpopular president, the inflation historically high, gas prices high, historically increased crime, trouble at the border. And it turns out that nobody really cared about it. Nobody cared that bread or floss was twice as much or increased crime. And turns out what voters really cared about is abortion and climate change, things like that. So it was a bizarre election. And especially with at the time of voting, you had a large percentage of the electorate of voters saying the country's going in the wrong direction, upwards of 40%. And despite that, by and large, they voted for incumbents to keep those in power to remain in power. So it was quite remarkable and baffling at the same time. And while it was embarrassing, was and is embarrassing for the GOP, they did win the House, though. They did win the House of Representatives, so they're going to have the lower chamber, while the Democrats maintained the Senate, the upper chamber, and actually picked up one seat. And so can we go to the next slide, Hannah? Okay, Erin, I'll let you hop in here. Yeah.
Sure. I'll just jump in and add a few things, and so both slides sort of go together. So, like as Mitch has indicated, the Democrats showed really unexpected resiliency in some of these toss-up contests across the country, not only in the House and Senate, but also in the gubernatorial races and some of the state legislative races. They avoided the midterm trend of large congressional losses for the party controlling the White House, which is a typical thing that happens. and because of that, Republicans were unable to thoroughly capitalize on, as Mitch said, a historically unpopular president and high and increasing inflation. What we saw was the quality of candidates and campaigns matters. Flawed GOP Senate nominees in, for example, Arizona, New Hampshire, and Pennsylvania won contested primaries against establishment-backed candidates, but were rejected by the general election voters. And additionally, the enthusiasm gap, the oft-touted enthusiasm gap between Democratic and Republican voters turned out to be a mirage, right? In the closing days, Democratic intensity picked up, and those issues of abortion rights and the January 6th insurrection proved to be motivating factors. And on the flip side, the GOP messaging on inflation, crime, and immigration did not deliver the votes. It's also several other things that are important to note is that younger voters turned out in record numbers, providing a significant advantage to Democrats. Democrats beat back several high-profile Republican challenges in governor's races, including Michigan, New York, and Wisconsin, and then flipped the Democrats flipped 3 states, Maryland, Arizona, and Massachusetts, from red to blue in governor's races. The Democrats also won abortion-related ballot measures in each of the 5 states where it was on the ballot, which sort of further underscores the priority placed by swing voters on the issue. And then one last important message, I think, which is important, is that this was a wholly unpredictable election, right? And we had never been in this place before. We'd never seen that. It was post-pandemic, mostly post-pandemic, post-Trump, and post rollback of Roe v. Wade. And I think that those were all things that you could never have factored into what was maybe going to happen. No one ever really had thought that it was not a predictable outcome. So I think everybody was surprised on all sides. And then, lastly, as far as this on the slide, a win is a win. The Republicans have took back the House, and I'll let Mitch, if you'd like to go through to the next few points on this, and then we can go into the Senate.
Right. Great points, Erin, and you're absolutely right that candidates do matter. And so as a Republican, it was really frustrating to see some of our candidates not perform well at all. And as the slide notes, Trump campaigned for 8 Republican House candidates, 7 of them lost. His Senate candidates also lost by and large. So just very frustrating. And this does not bode well for former President Trump and his campaign, right? It was a bad day for him, and so that we'll see how that unfolds going forward. But that did not help his chances in getting back into the White House. So, but Erin's right. So yes, I mean, at the end of the day, the GOP did win the House, and so that is significant. Even though that we really only have 4 votes we can spare. So there's only a 4-vote spread, a 4-person spread. So it's a really, really narrow majority. But we do still have the House. So that means that it is a return to divided government. And that means that President Biden's opportunities to pass significant legislative accomplishments are not going to happen. I mean, having the House will stop that. And so things like the Inflation Reduction Act, which was a major accomplishment for the Democrats, things like that will now be off the table because they don't have the lower chamber. And that means that they'll need to have legislation will have to be much more of a compromise and bipartisan, because when the Democrats had the House and the Senate, they could use a tool called budget reconciliation to pass things with a simple majority, and now they can't do that. So that's the big news in Republicans taking the House. And so you'll see more regulatory action and executive action from President Biden. In other words, they'll have to do things without going through Congress. He'll have to do things from the executive branch. And so that will limit his ability to get things done. And so again, compromise is going to be key here. So with that, I think we can go to the next slide, Hannah. And this just talks about this is the actual numbers, right? So as Erin, I think, mentioned, the one pickup in the Senate was Pennsylvania, where Fetterman beat Dr. Oz. And again, Dr. Oz was a Trump-backed candidate, wasn't able to get it done. So the Democrats picked up one seat. So instead of a 50-50 majority, sorry, a 50-50 even break, it's going to be 51-49 in the Senate for the Democrats. And in the House, it'll be 222 to 213. But that 222 numbers, it's a sort of, it's not that big of a majority because it takes 218 votes. 218 is the magic number to pass anything in the House. So you really need to look at that number, and that only gives the Republican majority a 4-vote margin, which is not large at all. But Erin, I'll let you talk about why the 51-49 is significant.
Right. So the 51-49 is significant, as you'll probably recall. When it was 50-50, the vice president was on deck to be the tiebreaker in crucial votes. 51-49 is significant as the committee breakdown is no longer a 50-50 split. So the Democrats are able to have a majority of the votes on committees, which is going to give them a little bit more wiggle room to move things through committee. Because they're going to now be able to add some seats. So they're keeping a majority, but also adding to their committee makeup, the seats on the committees. And this will just help them move legislation and nominations a little bit more easily through committees. So things that would in the past few years been stalled are going to be able to move a little bit faster and a little more easily through. And that'll just help with the sort of underlying confirmation agenda that every administration has, right, to get judges placed on the bench and members of the administrations confirmed and into slots, key slots in the agencies. So this will allow that process to move through a little more smoothly than it has been.
Okay, we'll do the next slide, please, Hannah. All right, so this is an interesting slide because, well, maybe you should go first, Erin, and talk about the historic leadership change with the Democrats, and I'll just say before I kick it to you that the Democrats with Pelosi have had a very, very smooth transition of their leadership. It's been flawless, and while I might not agree with Speaker Pelosi's policies, she is an incredible politician who controls her caucus and gets things done in a very efficient way. And so it wasn't a surprise to see their handoff of a new leadership regime to go flawlessly. Unfortunately, on our side, it's not going as smoothly. But Erin, if you address the Democrats, I'll speak about the sort of
Absolutely
what we're facing on the Republican side.
Sure. So I'll start. I'll kind of go backwards a little bit. Given on the slide, I'll start with the Senate. Nothing is changing there except for what we just talked about, sort of the committee makeup. But the Senators Schumer and Durbin are going to stay in their leadership spots in the Senate. The big news, though, was that Speaker Pelosi decided not to run for Speaker again for this upcoming Congress. She's going to stay. She's going to stay in the House and represent her district, but she decided she was going to step aside after a pretty remarkable career and quite a long time being there. She was the highest ranking woman in the U.S. until in history until the Vice President Harris was elected. She most notably for our audience here, she's the actual real architect of the Affordable Care Act. And she, as we all know, presided over the House as it impeached President Trump twice. So she definitely had her hands full for her tenure. She had 2 tenures. She was 2007 to 2011. She was the Speaker, and then she relinquished control to the Republicans for that 8-year period, and then she was reelected in 2019. And she's been a very, very prominent figure, and quite possibly the most prominent Democrat on the receiving end of the Republican ads like for reelection campaigns or election campaigns. But she decided to step down, and she turned her full support to Congressman Hakeem Jeffries from New York, who and Catherine Clark from Massachusetts, both of whom she'll be the whip. So Hakeem will be the leader, and Catherine Clark will be the whip, and they that has already been decided. So that's going to be coming up next in January.
Okay. Yeah. You want me to hop back in, Erin, or are you
Yeah,
still going?
please go for it.
All right. So, right. So very well done by Pelosi, and agree with her policies or not. She's an iconic politician who got just a tremendous amount done. So much respect for her. On the Republican side, we are like I said, we are getting the House of Representatives, and we're going to need a Speaker of the House of Representatives. So it's looking like it should be McCarthy, Kevin McCarthy from California, who's our current minority leader. But we'll talk more about that in a minute. And it also appears that Steve Scalise from Louisiana will be our majority leader, and then Tom Emmer from Minnesota will be our majority whip. And in the Senate, nothing changes for Republicans. Mitch McConnell from Kentucky will be our minority leader, and John Thune will be our minority whip from South Dakota. But as I said, let's talk about McCarthy a little bit, because unfortunately for the GOP, that is not a done deal. Usually it would be at this point, but let's talk about Kevin McCarthy. He was first came to the House in 2007. So he's been a member of the House of Representatives from California for 15 years. And it's worth noting that he tried to be Speaker before, and it just did not go well. This was back in 2015, when the far right conservative wing of the House of Representatives, better known as the House Freedom Caucus, basically removed Speaker John Boehner from power. And you might remember Speaker Boehner from Ohio, class act man who the far right was able to remove from power. So at that point, McCarthy was majority leader, and he thought he was the heir apparent to the Speaker gavel, but wasn't able to get it done, and had some foes that were able to stop him from getting the gavel. So for the past 7 years, he's been working toward this moment of finally getting the gavel. It's what he's always wanted. And ironically, the Freedom Caucus, who really removed Speaker Boehner, is now his biggest adversary in getting the Speaker gavel. So five of those Freedom Caucus members have indicated they plan to oppose McCarthy. So January 3rd is the big day to tune in, and that's when it's the first day of the new Congress, the 118th Congress, and McCarthy has to get 218 votes to become Speaker. And if you look at those 5 Republicans saying they're going to oppose, as of now, he does not have the votes to become Speaker. And we're not saying he's not going to be Speaker. We're just saying that he's got a lot of work to do between now and then, and we think that he's going to give away a lot of his power and wheel and deal and do whatever he has to do to get these 5 folks, or at least one of them of the 5, to support him. He can only lose 4 votes. He's a shrewd politician. I wouldn't be surprised. I think that the safe bet is he pulls it off, but stranger things have happened, and it's still not a done deal. So we'll be watching that and updating you closely on that. But unfortunately, it's not a great spot for the GOP, but that's where we find ourselves. And guys, reminder to please ask questions in the chat as we go. We're happy to take questions as we go here, but I think we'll go to the next slide, Hannah. And one more, we hit on that. Keep going. Keep new senators. I think Erin mentioned that.
Sure.
So
Yeah.
there's, yeah, I mean, it's 1, 2, 3, 4, 5, 6, 7 new senators. And the only flip, though, was Fetterman from Pennsylvania. So that, but on the Republican side, we have what, 5 new senators coming in from Alabama, North Carolina. So that's J.D. Vance from Ohio. I think J.D. Vance from Ohio is the only Trump-backed Senate candidate that actually won. So the rest of them did not, unfortunately. So, but we can go to the next slide, Hannah. Okay, so the Republican agenda for the 118th, it's going to be just a ton of oversight, because if you have the House but you don't have the Senate, you can't really pass anything or get much done without major compromise. So what they're going to do is a ton of hearings and oversight. So expect a lot of oversight hearings on the origin of COVID-19. And that means that we're going to see a lot of Dr. Fauci called up on the Hill to testify before Congress on how did this happen? How did COVID wreck our economy? And why didn't he see it coming? And all the things that he should have done better. You'll see a lot of NIH and CDC officials on the Hill. And then you're going to see things like the Hunter Biden laptop be a major story for Republicans, and things like border security. I don't think anybody's talking about impeaching Biden, thank God, but there is talk about impeaching the Homeland Security Secretary, Mayorkas. So things like that, climate change. You'll have climate change hearings and how that's really not a big of a deal as the Democrats think it is. So it's going to be a lot of that, just a lot of oversight. And Erin, I'll let you add your thoughts on what you think the Republicans are going to do here.
Well, I think that I agree. Yes, there will be a lot of oversight. I think, though, given the very small margin that the House Republicans have, they're going to have to be really careful, because they are going to need some Democrats to vote for things. So I think there is, there's always room for compromise. I think this, there's going to have to be a decision made. How much compromise are they willing to give this year with the on both sides? So I think it all kind of remains to be seen. Yes, there's going to be a lot of investigations. Who's to say how that's all going to pan out? Most of it is just messaging, which both sides, both the Democrats and the Republicans, are use that tool in their toolbox, right? For every time they're in power, there's always some sort of investigation as a part of a messaging agenda. But I agree, that's sort of the direction it will go.
Right, and that's a great point about the narrow. So let's say Kevin McCarthy does become speaker, which is the safe bet. Erin's right. With only a 4-vote majority, it's going to be really tenuous for him. And if you think back to when John Boehner was speaker, I was on Capitol Hill at the time, and it would regularly happen where they'd bring up bills for a vote on the House floor and fail and lose votes on major pieces of legislation. And because Boehner and I think McCarthy is going to have a very hard time corralling his caucus. They are not Nancy Pelosi. Kevin McCarthy is not a Nancy Pelosi that can deliver the votes. It was almost unheard of, for basically never happened, where Pelosi would put a bill on the floor and it wouldn't pass. She could count her votes and her caucus would follow. I think it's going to be totally different with McCarthy, and he's going to have a really hard time getting his caucus in line. And so yeah, I think we'll have some really embarrassing moments where we won't even be able to pass our own bills in the House. And that will be frustrating and embarrassing for the GOP All right, I think we can go to the next slide, Hannah. Okay, healthcare policy outlook. And so we talked a little bit about the COVID-19 oversight investigations and a lot of, I think they're also going to look at a lot of money that went out from Congress to hospitals and physicians called the Provider Relief Fund. When COVID happened and the hospitals weren't seeing their patients, it was a really, really bad scene for hospitals because basically, as you all know, I mean, anything that wasn't an emergency, anything that was not urgent care was not getting done. And so basically the government infused physician and hospital practices with money to keep them afloat. And you're going to start to see investigations on how that money was used, where it went. And there was already a really, really bad Wall Street Journal article about how hospitals, this was a couple of weeks ago, about how hospitals, some of them didn't need all the money they got and what they did with that money. So they're gonna be looking at things like that. Telehealth's going to be a big issue, and the COVID-19 pandemic led to the loosening of telehealth restrictions. Historically, that was only for rural areas, and that really was expanded dramatically due to COVID. So you're going to see a lot of talk about keeping that expanded. Rising healthcare costs are going to continue to be a big issue. The cost of pharmaceutical drugs, the cost of care in a hospital will continue to be a big issue, but the argument will be how Republicans and Democrats differ on dealing with those issues. And as Erin alluded to, the abortion and the Dobbs decision, I think, will continue to be a big one, and healthcare in that sense. Erin, anything to add on that slide?
No, I think you've covered all that.
Okay, we'll go to the next slide, Hannah. So what this means for DPC, well, if you look at your issues and the things that you work on before Congress and the legislation you have before Congress, you have always had great bipartisan support for your legislation. We can look at past Congresses where your legislation has had over 200 co-sponsors, which is a lot, and they've historically been evenly divided between Republicans and Democrats. So we think that a divided government and actually for your purposes can suit you well, because we believe that it is one thing that can get done with bipartisan support. We'll go to the next slide, Hannah. So we were asked to speak specifically about one of your main legislative priorities, which is called the Restore Protections for Dialysis Patients Act. And I'm sure a lot of you are familiar with this. If not, I'll do a quick recap. But this legislation comes in response to a Supreme Court ruling that basically said private health plans can prematurely force ESRD patients onto Medicare. And the Supreme Court case is Marietta versus DaVita. And Marietta is a hospital health plan. And so this legislation basically says that, look, ESRD patients should be able to stay on their private health care as long as they want, or at least as long as they can before this decision, basically to keep it how it was before this bad court decision. So, and in looking at your bill, Megan at Dialysis Patient Citizens asked us to look at a previous bill that passed in a previous Congress, and it's called the Immunosuppressive Drug Coverage Act, and what that was a huge win for the kidney community, because so now, because of that bill becoming law in next month in 2023, Medicare will now cover immunosuppressive drugs for kidney transplant recipients, which they'd never done before. And that bill took almost 2 decades of work to get it done. Now, your bill is not going to take that long, so don't misunderstand what I'm saying here. But what happened with that bill is remarkable, and we think it bodes well for your current bill, which we think will happen because of this bill much quicker. So long story short is that the price tag of that immunosuppressive drug bill was massive, and that was always the holdup, was Medicare having to cover and pay for these drugs. So finally, HHS basically they finally figured it out, that, and they said that this bill will prevent almost 400 transplant failures a year. And so after a long slog and fighting with the Congressional Budget Office, which they score all the bills, the CBO, the Congressional Budget Office, finally realized that this bill will save money because there won't be these transplant failures. So they finally came around and realized that it would save $400 million over 10 years. And that's a lot of money. So because of the work done with that bill, we think that the Congressional Budget Office will see your bill in favorable light and also score your bill favorably. And so that's why we have optimism that your bill can and will get done in short order, because of the previous work you all have done on the immunosuppressive drug bill. We can go to the next slide, Hannah. So lame duck is what we are in now, and they call it the lame duck because it's a period of time where Congress is still meeting to pass legislation, but you've got all the members of Congress that lost. They're still here and can vote. So it's this weird sort of in-between period, and it's where, actually, ironically, that's where a lot of things and big bills get done. But the must do for Congress is they have to fund the government. And so that's what we're facing now. The government runs out of money tomorrow, but luckily they passed a 1-week short-term funding bill that'll get us to December 23rd. And they have between now and then to come up with what we call this big government funding bill that would fund the government all the way through the fiscal year of 2023. So that will take you all the way through September 2023. And they call that this big omnibus package. And for your purposes, for your bill, there has been a sincere and significant effort to get your Medicare secondary payer bill, the one we just referenced, into this big omnibus package, and great progress is being made. Yeah, but as we sit here today, we're having some issues with the scoring, as we alluded to in the previous slide with the Congressional Budget Office. So work is being done with the CBO and our congressional champions, and so we are optimistic that in the next Congress, CBO will come around like they did with the immunosuppressant bill and see your bill favorably in the budget, through a budget lens. And but I think that might be our last slide. What's next after this, Hannah? Okay, question. Yeah, so Erin, before any questions, anything that you'd like to add or that I missed about the lame duck or anything like that?
No, I would just add that this is, although it feels like an emergency situation when the money runs out tomorrow and they have to pass another 1-week continuing resolution at current levels, this is not something that's uncommon, and this is a sort of a typical end of the year scenario. It's been quite some time since we had a regular process, regular order for the appropriations bills. So this is sort of a sort of something that the members use to sort of force their hand, right? So they wait till the last minute, and this is one of their bargaining chips, because nobody wants to not fund the government. So I feel like this is a scenario, we've seen this movie before, right? This is what happens, and it's all they'll get it done by next week. And if for some reason they don't, they'll do another short term into early January. But I think we're pretty sure that the Republicans don't want to have to deal with this in January. They've got other things on their agenda, so they're going to want to get this done as well.
Yep, I think that's what we've got for you, Hannah. And if anybody's got questions, we're happy to take them.
Great, thank you both so much. While we just wait to see if anybody has any questions after digesting kind of all this information. I was wondering if you have any recommendations in the next year for our members as they, continue doing letters to the editor, op-eds, speaking to their members of Congress with, some of the changes. Do you have any recommendations for, messaging or just how to make sure that we want to keep, our kidney patients' priorities top of mind?
Right. And thanks everybody for taking time out of your day to listen to us. I really appreciate it. And Hannah, you're absolutely right that Congress hearing from you all is the hands down 1,000% way better than hearing from us, because you know the issue firsthand way better than we do. You are constituents and you are experiencing it. So your members hearing from you, whether it's a phone call to your congressman or senator or a letter or an email or an op-ed, really makes a huge difference. And when you all do your fly-in, be it virtual or in person, you all being there and participating is just so important. I can't stress it enough, because I was on Capitol Hill, so was Erin, and when we heard from the actual patient groups, that always had a huge impact on me in those meetings, and I know it continues to do for Hill staff. So I commend you all for being on this call and all the work you do, and I encourage you to continue to do it, because you all make the difference, not us.
All right. Well, I want to thank Mitch and Erin for sharing their insight with us today. This has been some really great information to have. And I want to thank everyone who joined us. Please complete the brief feedback form that can be found in the chat box. And we wish you happy holidays. Please join us in the new year on January 26th at 2 p.m. Eastern for another informative program for people living with kidney disease. Thank you both again so much.
Thanks, Hannah.
Thank you. Have a great day. Happy holidays.
Thank you.